I'm Jeff Deloach. My specialty here at Orthopedic Associates is physical medicine and rehab. My practice involves pretty much most of the things that the orthopedic surgeons see, except I don't do surgery. I treat orthopedic or musculoskeletal injuries or problems without surgery, using conservative as well as some interventional treatment procedures. But if anything needs an orthopedic surgeon, then they are referred on to one of the surgeons. Well, the type of patient that should make an appointment with a physical medicine doctor or a physiatrist that we're called would be anyone with any type of painful condition of the musculoskeletal system, being joints, muscles, bones. Spinal problems are probably a majority of what I see, spine complaints, herniated disc, that sort of thing, but also work injuries, athletic injuries of any body part are treated. The latest trend in physiatry or physical medicine and rehab is the use of ultrasound, diagnostic musculoskeletal ultrasound. There's a lot of research going on with physiatry where ultrasound is used to diagnose muscle, tendon, and ligament problems. Use of diagnostic musculoskeletal ultrasound to image soft tissue injuries involving nerves, muscles, and tendons. Also use of ultrasound with guiding injections into bursas and joints, tendon sheaths. And there's a lot of work going on in that right now. So that's kind of a new and exciting field. Well, we have several general orthopedic surgeons. We have myself, physical medicine and rehab. We have a family practice doctor who specializes in sports medicine. We have hand surgery. We have a spine surgeon that does the surgical procedures for spinal problems. He and I work together pretty closely. We have some sports medicine fellowship trained surgeons that have a special interest in treating sports injuries. Well, I think one thing we stress here is exceptional care of the patient. We try, make it a priority in our practice with our staff and with ourselves to put their care first above all other concerns. I don't know if that's different from everybody else, but that is always the primary concern whenever we see someone, is to provide a service as well as take care of them. I think every doctor in our practice is some of the very best in their field. There's not any weak link. I'm asked all the time, well, if I need to refer someone to a surgeon, well, who would you send to? And there's not anyone that I wouldn't send my mother to. So there's none that are kind of below a standard level that I'd say, well, don't see that person. I think everyone is excellent, and I don't know that every other group is like that, but I think that may set us apart, where some may have some doctors that are not as strong as others. Spinal injection procedures, their injections are not surgical, but they are precise injection of either cortisone, steroid, or anesthetic for diagnostic block in structures involving the spine. I also do electrodiagnostic evaluations for nerve conditions. Those are nerve tests to test the functioning of a nerve that we think may be compromised, causing some numbness and tingling in any extremity. I do see children. I see children that injure themselves on the playground, sports injuries, even some spinal injuries in children. I would say the number one challenge with treating children is just making them maybe reduce what they want to do. Kids want to go out and play, so sometimes when you tell them, well, no, we need to rest this part, or we need to take care of this and rehab it, it's hard to get them to slow down or stay on the sidelines and not continue doing what they want to do. Parents require a lot more education, and that's where that focus is directed with the parents, is just to educate them what's going on, what's happened, what's it going to take to get them back into the game or back into regular activities. Well, the main goal is, of course, injury recovery. Also, in rehab is part of that. I guess a secondary goal, sometimes patients have to kind of learn to live with some limitations from an injury or surgery. So one of the things that physical medicine and rehab stresses is a functional recovery. So you can function at the optimum level with any limitations that you may have. Providing the best service for our patients is the goal. We try to understand what the injury what the impact of that injury is on that person's lifestyle. Try to understand, help them understand what it's going to take to get back to their optimum level of functioning. Sometimes when you see a patient, especially a new one, you're really just trying to get to know them a little bit. Often we'll find something in common, and either they went to the school we went to, they have kids that do similar activities, they play golf, they are involved in some activities that my kids are involved in or I'm involved in. So a lot of times we'll find something in common and get to chatting about that. And it helps to get to know them a little bit better, and that also helps their treatment. Well, in my specialty, physical medicine and rehab, I finished a residency in physical medicine and rehab. After that, I decided I wanted to specialize in this type of medicine, in musculoskeletal medicine, as well as the painful spinal conditions. So I chose to do an additional year of training where that focused on just that, seeing injuries day in and day out, learning the spinal injection procedures in addition to what was covered in residency. In physiatry, my subspecialty would be two things: musculoskeletal injury as well as pain medicine. The musculoskeletal side is the sports injuries, the work injuries. The pain side is the spinal problems that people come in with, the spinal injections that I do, both of which I received fellowship training for. Well, my most common procedure would be epidural steroid injections. That's a steroid or cortisone injection into the epidural space into the spine. The spine has nerves, of course, that run through the middle and depart out the side. And there's a space around them, and if there's a painful spinal condition or pain that radiates into an extremity, an epidural steroid injection under X-ray guidance can help reduce that pain. And that's probably the most common procedure that I do among the spinal injections that I do. Well, the advanced technologies would be the fluoroscopy, which is the X-ray guidance for the procedure. Also in office would be the musculoskeletal ultrasound that we use for diagnosis and injection guidance as well. And also the use of the electrodiagnostic equipment to diagnose nerve problems as well would be I would suppose an area of technology and ongoing research. So keeping up with that is done through academies and meetings and courses that I go to periodically. My family and I live here in Round Rock. I have two sons. One is 10, about to turn 11, and one is 8. They're both in sports, playing flag football, basketball, baseball. They're in Cub Scouts, so they keep me pretty busy. I used to like playing golf, but as they get older, I get busier, so that's become less and less. But I like photography as well. I went to Baylor, so I try to keep up with those sports, which is difficult in Austin. We live in the Forest Creek area and are active in First Baptist of Round Rock.